Hey, this is Rick Chen. Back pain and sciatica have been my major clinical focus for over 20 years. Every day we have patients recover from the most challenging causes of back pain and sciatica that doctors do not think there was a solution other than medication, injection, or surgery. I personally want to thank you for registering this workshop and congratulations for taking the first step towards being pain-free again. This workshop is different because you will understand the real cause of your pain that no one has explained to you correctly before. I will show you a 5-minute live demonstration that produces significant result. You may be randomly selected as the lucky demo subject. Everyone will have a chance to experience the unique assessment and treatment. Before that, however, you need to answer one very important question first to help decide if this workshop is for you. The question is your pain, numbness, or tingling reproducible? In the past 7 days, when you experience pain, numbness, or tingling, what activities were you doing? If your pain is caused or aggravated by activities, then it is a good indicator that the cause of your pain can be fixed without medication, injection, or surgery. Some of the most common activities that lead to these symptoms include standing, sitting, walking, sleeping, lifting, housework, gardening, driving, running, doing stairs, getting dressed, or getting in and out of the car. If your pain, numbness, or tingling is reproducible by activities, then it can be reducible. It goes away when we address the cause of your pain. In the workshop, I will show you how we can find the cause. We love challenging ourselves, so we especially want to see you if your scan shows bulged disc or pinched nerve, if you have been to treatments elsewhere without success, if your doctors told you there was no solution other than medication, injection, or surgery, or if you are just about to give up hope. That's all for today. I will see you at Back Pain and Sciatica Workshop.